Hello, I'm Deborah Eastwood. So who am I? Well, I am a consultant paediatric orthopaedic surgeon. I'm also an associate professor at UCL. But more importantly to you, who we are welcoming to the RNOH, I am your Director of Medical Education. But what does that mean, I hear you say? What do I actually do? Well, in essence, I chair the Medical Education Committee, and that meets every 3 months. It's that committee that advises the Trust on all medical education issues. It provides the support for the doctors regardless of whether you are in training posts or not. The priorities of the committee are, of course, to work very closely with UCL. For example, to devise and deliver appropriate medical induction programs like the one you're attending today. To make sure that our simulation skills teaching is also appropriate for the skills you need to learn, and to make sure you have the opportunities to utilise this teaching facility. In short, we're here as the committee to ensure that we provide the training opportunities for all the doctors. The CTs, the registrars, they all have weekly teaching sessions. And of course, you all have access to the teaching clinics, which the consultants here at the hospital encourage you to attend. As a committee, we have a responsibility not only for the trainees, but your educational supervisors as well. And between us, we aim to deliver a full gamut of educational opportunities, which include things like the grand rounds, case-based discussion groups, and a forum for the non-consultant hospital doctors to meet and to discuss relevant topics. All these educational opportunities are open to all, and you are all welcome to attend these. The committee also oversees the educational and the clinical supervisors. There is a professional developmental framework for the supervisors, which is used to define the standards for selection and the accreditation of your supervisors. It considers their roles quite carefully, particularly, for example, given the changes in the trauma and orthopaedic curriculum, which will take place in the summer of 2021. You will be allocated an educational supervisor when you arrive at the RNOH, but it is your responsibility to involve the clinical supervisors as you see appropriate. These can be within your team or outside it. They can, for example, be fellow trainees, other trainers that you interact with, and of course, allied health professionals with whom you work closely. In light of the new changes, where the multi-consultant report will become increasingly important, we do advise that you engage with as many trainers as you can. Because the more people who know you and who can comment on your abilities, the better the assessment of your progress will be, and the more we can help you make of your educational opportunities. There is also a GMC national survey, which I hope some of you have been aware of in the past. It's an annual survey. Its aim is to improve the quality of training within the UK and to give you, the trainees, a voice. It helps us understand what's working well and where changes to our educational and training programs are needed at a national level, but obviously also at a local level. The survey crosses all different specialties, so you can see what might work well in a different specialty and then try and bring the good points into trauma and orthopaedics. Of course, here at the RNOH, we also cater for trainees in anaesthetics, pathology, paediatrics, metabolic medicine, etc. So it's important that you all fill in the survey. As the Director of Medical Education, I receive the anonymised results of the feedback. It's colour-coded and it shows me where the good areas are and those we could improve. And there forms the basis for the medical education plans for the next year. Sometimes it's big things, sometimes it's small things, but year on year our areas for improvement change. Sadly, there's always something that hits the bottom and needs to be improved upon. Not that we're ever really bad, but of course, like everything in life, we could be better in some of the areas. What are the other priorities of the Medical Education Committee? Well, obviously when Health Education England pay us a visit and assess our quality and develop an action plan, then of course we take note of that and make sure that the improvements that they want to see, that they are enacted. We enact those, as I said, and on the GMC survey results and on the training census through our educational and clinical supervisors. This all comes together to ensure our training is improved. The core trainees or the core surgical trainees have a training plan too, for which the surgical tutor is responsible, and that's at the moment Sally Tennant. Yes, there are core skills and mandatory training which you must be compliant with. This is true for all the medical staff, I'm afraid. It's important that you undergo this training, and I know it's a nuisance, but you do need to do this on an annual basis if you are staying at the RNOH. It's important that we are seen to know what we are doing and to know how to respond to areas of conflict, for example, areas of clinical concern and areas of professional responsibility. On a happier note, the MEC is also responsible for the administration of your study leave for all the medical staff at the RNOH. The study leave needs to be appropriate to your level and should be discussed and approved with your educational supervisor as being appropriate to this stage of your training. In the new trauma and orthopaedic curriculum, there are not going to be as many mandatory courses to go on as there were. But there will be courses that you and your educational supervisor would feel would help you prove or give you evidence, if you like, that you have acquired the skills and the competencies that you need to progress through ISCP and through your ARCPs. So what I do hope is that you take note of the names and maybe the telephone numbers and email addresses of the people on the screen now, because these are the key contacts at the hospital for all elements of education and training. Namely, also myself as Director of Medical Education, Adi Majed as your Guardian of Safe Working, and Sally Tennant, who's a surgical tutor, and has prime responsibilities for the core trainees and to our junior academic fellows. We are supported very ably by our medical education team, including Seema Ahmed and June Lee. You know where I am. I'm here at the RNOH. I'm based in the Catterall unit, and my door is almost always open. I seem to be at the RNOH quite a lot, so if you have any queries or questions, please come and find me. Drop me an email, telephone me, but do come and find me. And on that note, may I hope that you enjoy your time at the RNOH, and I welcome you to the hospital.